afternoon, and thank you for joining us for today's virtual media briefing about COVID-19 in London and Middlesex County. We're glad you could join us. I'd like to welcome the media who are in attendance this afternoon, and a reminder that if you have not yet submitted your questions, just click on the text bubble here on Microsoft Teams. It has the question mark in it. And when you do submit your questions, if you could indicate your name as well as your media outlet and who your question is for. And speaking of who those questions are for, I'd like to welcome this afternoon London Mayor Ed Holder, as well as the Medical Officer of Health here at the Middlesex-London Health Unit, Dr. Mackie, and the Executive Vice President, Interim Chief Clinical Officer, and Chief Nursing Executive at London Health Sciences Centre, Carol Young-Ritchie. And finally, a welcome to those who are tuning in this afternoon on Rogers, as well as the Rogers Facebook page and YouTube channel, those listening on Global News Radio, 980 CFPL, and those who are following us and watching us this afternoon on the CTV London website. We've got lots of ground to cover today, so let's start with the opening remarks, and we'll begin with Mayor Ed Holder. Mayor Holder.
Well, thanks, Dan. Good afternoon, everyone. So here's more positive signs in London, Middlesex, and across the province following our first weekend under Step 2 of Ontario's reopening plan. After I spoke with the head of bylaw enforcement, I'm pleased to report that there was full compliance following more than 60 inspections of local shopping plazas. Having said that, charges were issued to a pair of restaurants, including a repeat offender, for allowing indoor dining. There was also a large gathering on Talbot near St. James, and one parks bylaw penalty, which was issued to the organizer of an anti-mask, anti-vaxxer rally in Victoria Park on Saturday afternoon. In spite of those charges, our positive momentum does continue. Case counts remain low, and vaccine uptake is very strong. This absolutely must, and I believe will continue in the coming weeks so that we can enjoy a more normal summer and an even better fall. In the meantime, with this ongoing heat alert, some people may choose to spend more time indoors than they might otherwise. But if that's the case, please remember it's vital to ensure that you're spending time with our fully vaccinated. And there's still indoor gathering limits of no more than 5 people per household. And lastly, I just wanted to quickly highlight the return of Tourism London's Stay a Little Longer program, which was launched today and runs until the end of November. Basically, Londoners or anyone visiting from out of town who book a minimum 2-night stay at a participating London hotel will be given a $100 Visa card at check-in to spend during their stay. If you're interested, you can find more information at londontourism.ca/stay. And we encourage folks to treat themselves and friends with that kind of an opportunity. But thanks again, London. Thanks for caring as much as you do for your support of local business. And thanks for your support by getting your shots and your second shots. We're doing this together, and I'm extremely proud. Over to you, Dr. Mackie.
Thank you very much, Mr. Mayor. I appreciate your words. We are at 509,954 vaccines delivered as of the end of day yesterday. That's a truly tremendous task that really only could take, it could be done by all of the teams working together in the healthcare sector, as well as all the people who came out and gave their arms to us to vaccinate. So huge thanks to all of those partners and to every single client. I want to stress that those 510,000 vaccines, 100,000 were delivered in the last 2 weeks alone. Again, tremendous achievement, about 90% of those through the mass clinics and health unit partners. But I really want to stress the importance of the pharmacy campaign as well. The pharmacies are in those numbers and have been vaccinating very quickly thousands of people as well. So huge thanks to all of those partners. The other information that we have to share today about the vaccine campaign is that we've looked at our cases over the last 2 weeks. And of the cases we've had in the last 2 weeks, 92% of those positive COVID cases were among people who had no vaccine at all, 92%. 8% were among people who had just 1 dose of COVID vaccine, and 0, not a single case of those roughly 200 cases were among people who had been fully vaccinated. It just stresses the importance of getting vaccinated, getting fully vaccinated. All of that said, with the accomplishments that we've had, it is not time to rest on our laurels. We need our community to engage in 2 crucial parts of the pandemic response right now. First, we have tens of thousands of appointments available in the second and third weeks of July for people to rebook their second doses. It's no longer really an option. We absolutely need you, and you need to rebook your second dose as soon as possible in order to prevent the spread of the variant, the Delta variant. We have seen 20 cases of Delta variant here in Middlesex and London, but also in neighboring communities, we're seeing large outbreaks. Waterloo and Grey Bruce were both identified in the Minister of Health's daily tweet today as some of the communities with the highest counts of COVID cases. Waterloo and Grey Bruce are also the highest in terms of the spread of the Delta variants, and many of us have important connections to those communities. So it's so important that we get vaccinated 2 doses as soon as possible. The other crucial part where we need the public and every single person living in Middlesex and London to play a role is avoiding indoor gatherings. There is just no good reason to have an indoor gathering that isn't absolutely necessary right now. That is where we are seeing the vast majority of spreads of cases. Indoor gatherings, masking and distancing can help, but it really just doesn't need to happen right now. With the weather being what it is, if you can avoid indoor gatherings, please do. That's it for me for now. I'm happy to pass to Carol Young-Ritchie from LHSC.
Hi, everyone. Good afternoon. And I'm glad to be here today to provide COVID-19 situation at London Health Sciences Centre. I'm pleased to report that we are continuing to see COVID-19 related hospitalizations leveled off. As of this morning, we are caring for 9 COVID-19 positive inpatients, and fewer of 5 of those are in critical care. Our associated outer region numbers are less than 5 in critical care and 0 in acute care. We're also happy to note that the COVID-19 outbreak in our transplant unit at University Hospital was resolved as of last Tuesday. I'd like to take an opportunity to thank our teams for their diligence in executing enhanced protocols and safety measures to ensure contamination was swiftly resolved. Lastly, I'd like to share, as of today, we have again expanded our care partner presence policy. Both adult and pediatric inpatients are now able to identify up to 4 care partners who will be eligible to visit in alignment with our visitor policy limitations. We recognize the importance of staying connected with loved ones while they're in hospital, and we're pleased to be able to safely introduce additional flexibility for our inpatient visitation at this time. We continue to thank our community for helping make it possible by following the public health rules and getting vaccinated as part of our ongoing collective efforts to reduce the spread of COVID-19. Thank you.
And thank you, Ms. Young-Ritchie, Dr. Mackie, and Mayor Holder for those opening remarks. We do have some questions to get to, so let's begin with those right away. Mayor Holder, the first question this afternoon is for you, and it comes from Jaden Lee Lincoln at CTV News. Mayor Holder, how has the city modified its summer camps in order to keep kids engaged while respecting social distancing?
Thanks for the question, Jaden. A couple of things that I think are distinct and very important. Firstly, campers are going to be screened for symptoms upon arrival. In addition, families will be assigned a specific drop-off and pickup time and absolutely required to adhere to their assigned time so that we can avoid mixing with other cohort groups. I'd also tell you that staff are going to be required to complete a daily health screening and will be wearing personal protective equipment. And along the lines of things you'd imagine, like physical distancing within cohort groups to be enforced. I will tell you too that playground programs will support a maximum of 20 participants, which will be separated into 2 cohorts of 10, and a maximum of 40 campers per summer day camp per location. Now, some smaller sites will be accepting fewer campers, but you get the sense of what we're dealing with there. I'm going to suggest as well for anyone that's interested in more specific information to go to our website as well. I think that could be very helpful. That would be london.ca/daycamps. And if you go there, I think there'll be some even more specific and we hope more helpful information as well. Thanks.
Thank you very much, Mayor Holder. Let's go to our next question. Dr. Mackie, this one is for you, and it comes from Jennifer Beeman at the London Free Press. Dr. Mackie, what proportion of daily appointments are for second doses? Is the pace of first doses slowing And is this a concern for overall vaccine coverage in the London area?
Yeah, for sure. We're watching that closely. The pace of first doses have certainly slowed, but that's primarily because there's fewer and fewer people in terms of first doses left. About 15 to 20% of our appointments continue to be for first doses. That does change over time. As we see first doses reducing, we are seeing second doses increasing. The population is about 80% first dose vaccinated, ballpark. We haven't got the final figures from last week yet. So it makes sense that about 20% of the appointments would be for first dose and 80% for second doses. But it definitely is something we're watching closely. And again, as you know, implementing all sorts of strategies in terms of outreach to get into new places where we could potentially meet and vaccinate new clients.
Thank you, Dr. Mackie. And just for the media, a reminder that tomorrow, Tuesday, the 6th of July, we will be updating on the Health Unit's online dashboard the vaccination breakdown by age cohort in terms of percentage vaccinated. That will be for the week that ended on Saturday. So that data will be updated on the website tomorrow. Let's go to the next question. And Dr. Mackie, it's a follow-up for you from Jennifer Beeman. What are our vaccine shipments in the coming weeks?
Yeah, Jennifer. So we have had a tremendous amount of Moderna shipped last week and the week before. So Moderna is now by request. We did not request any this week, in part because we're getting back into the Pfizer business and numbers. About 11,700 Pfizer coming this week. Next week, we have 17,130 Pfizer that are committed. The following week, 32,760. So you can really see Pfizer allocation accelerating over the next couple of weeks. And the week after that, the week of July 26th, we have 38,610 Pfizer coming. And we'll supplement with Moderna as we need to. Those Moderna shipments are back in the realm of being less predictable. But we should be able to pull them in as we need over that time.
Thank you, Dr. Mackie. And one more question from Jennifer Beeman for you. Dr. Mackie, with the 10-school blitz finished, where will the Health Unit's mobile teams be deployed in the coming weeks? Is the Health Unit considering walk-in clinics for COVID-19 vaccination?
Yeah, for sure. Thanks for asking, Jennifer. So all sorts of places are on the table right now. We are working with faith groups. We've had a number of pop-up clinics in whether it's one in the mosque, church, temple, synagogue, that sort of places. We're continuing in schools. We have another clinic later this week that will have walk-in capability in a school. Dan, you may have the name of that school handy. We also have a walk-in clinic on the 8th this week at City Plaza. That will be, we are certainly encouraging and supporting folks that live in the downtown area to access that walk-in clinic at City Plaza on Thursday. We also, anyone is welcome there. It's walk-in, and there'll be several hundred appointments available there as well. And then we have a whole bunch of second dose clinics that we'll need to offer, in the schools over the next couple of months. And then, we're out in Dorchester, I believe it is later this week, for the second dose appointment from the first pop-up clinic that we had there. Middlesex-London Paramedic Services is in a number of businesses and continuing on with vaccinating people who are homebound. There's a lot of outreach happening right now.
Thank you very much, Dr. Mackie. And I did have the Thursday clinic at City Plaza. Going to work on those others. The Glencoe clinic is coming up. It's actually today in Glencoe, and tomorrow we are in Strathroy. So those clinics with the mobile team, Jennifer, yes, they're very active, and there will be more information about that as further clinics are scheduled and finalized. We'll be sure to let people know when those are and where those are so that people can get either their first dose or their second dose at those. Let's go to the next question. Carol Young-Ritchie, this one is for you from Jennifer Beeman at the Free Press. Ms. Young-Ritchie, how much capacity is LHSC reserving to respond to the pandemic while it ramps up surgical volume?
Great question. We are keeping about 10% of our inpatient capacity ready to respond to the pandemic. So we're trying to keep our occupancy in the hospital around 90%. And again, that's to be flexible as needs change and as the pandemic changes.
Thank you very much. Let's go to our next question. Actually, there are two questions here that are very similar. They're both for Dr. Mackie, so I'm going to combine them. One is from Jacqueline LaBelle, the other is from Craig Needles at Blackburn News. Jacqueline LaBelle, of course, at Global News Radio 980 CFPL. Dr. Mackie, on Friday, the Middlesex-London Health Unit announced an outbreak tied to indoor gatherings at Christ Embassy Church. What is the current number of cases associated with that outbreak? And then picking up on Craig Needles' question, in addition to has the number gone up since that news was announced, will the church face repercussions for breaking public health rules?
Yeah, so thanks for the questions. So the latest case count for the Christ Embassy Church outbreak is 6. We are awaiting a number of tests of people who were contacts in that situation. You know, our focus right now is controlling the spread of illness there. We are not focused on punishment. We are working with the operators of that facility to make sure that safety protocols are put in place and that, you know, we can reach in partnership with them to the congregation to make sure everyone gets that information directly around the risks that they've faced.
Thank you very much, Dr. Mackie. The next question comes to us from, again, Jacqueline LaBelle at Global News Radio. And Carol Young-Ritchie, this one is for you. The outbreak that was declared over last week at 8TU at University Hospital was believed to have involved the Gamma variant. Has that been definitively confirmed?
Yes, it has. The outbreak on the transplant unit was the Gamma variant.
Thank you very much. Next question. Back to a question from Jennifer Beeman at the Free Press for Dr. Mackie. Dr. Mackie, of the 8% of recent cases partially vaccinated, were they within 14 days of their shot or further out?
Yeah, the analysis that we did didn't break that down.
And a follow-up from Jennifer Beeman, and she said, never mind, it was about Christ Embassy Church, so that one has been answered. Normally, I have a little bit of time to ask for any last questions from the media, but we have exhausted the questions in queue, so if there's anything that comes in at the last second, we will let you know. Just a reminder again that tomorrow, Tuesday, the 6th of July, there is that mobile clinic in Strathroy that is happening, and you can get details about that on the booking website, covidvaccinelm.ca. And also a reminder that the weekly vaccination data table on the health unit's online dashboard will be updated tomorrow with the most recent percentages by age tranche by 5 years on the website. So that will be something to check out. We are out of questions, and I think we are out of time as well. So Carol Young-Ritchie, Mayor Ed Holder, Dr. Chris Mackie, thank you so much for your time, for your insights, and for the information that you provide at these briefings to the community. It is very much appreciated. That will do it for today. We'll be back for our next virtual media briefing on Thursday, and that will happen at 2 o'clock. We hope you will join us then. In between now and Thursday afternoon, have a great rest of your Monday, and so long for now.